In 2018, prostate cancer kicked Australia in the ass, diagnosing 17,729 males. And out of this, 3,500 of them died. Prostate cancer accounts for 12.7% of all male deaths from cancer. However, there is a 95% chance of surviving at least 5 years, which gives room for treatment options. There are 3 current approaches for detecting and treating prostate cancer. The first involves an ultrasound probe which is inserted into the anus. Once inside the rectum, the ultrasound beam emitted from the probe can map a 2-dimensional image of the prostate gland. From here, tumours can be detected. By using the high-frequency ultrasound wave on the probe, tumorous tissues can be heated to above 55 degrees for 1 second or more, causing a localized tissue necrosis. The second method involves MRI scanning to produce a 2-dimensional scan of the prostate gland, where abnormal growths can be detected. The third method is a combination of the above two, where a fusion processor uses an already collected MRI scan and combines it in real time with the ultrasound probe to formulate a 3-dimensional map of the prostate gland. No incisions are needed, no unnecessary tissues are damaged by the ultrasound waves, and according to current peer-reviewed data, this method of treatment has a high success rate for treating prostate cancer.
With many treatment options available for prostate cancer, the major objective is to achieve more precise disease characterization. In clinical practice, MRI is one of the imaging tools for the evaluation of prostate cancer. The newest imaging technique in the diagnosis and monitoring of prostate cancer is multiparametric magnetic resonance imaging, MP-MRI. Due to a reduction in the frequency of annual biopsies in patients, MP-MRI has been used to reduce the cost of treatment and complication rates. As a result, patient compliance has increased due to the non-invasive nature of the diagnostic tool. Functional MRI techniques can provide metabolic information, show altered cellularity, and contribute to the non-invasive characterization of tissue and tumor vascularity, and have been evolved to complement conventional MRI in the detection and staging of prostate cancer. This may improve cancer detection, particularly in patients with previous negative biopsies. Multiple medical trials have been done, and as a result, at the end of 2018, the Australian government agreed to provide Medicare funding for the new scan. Advantages in the new imaging technique is that it is used to reduce the need for previously used painful biopsies, as well as MP-MRI being cheaper for the government and patient due to it being new on the MBS. MP-MRI complements standard clinical exam, PSA blood test, and systematic biopsy that may miss some tumors that lack enough size or change in tissue density. MP-MRI is likely to be used increasingly, and further advances will be important to a safe adaptation of focal therapy concepts. Although MP-MRI can detect lesions in the base and mid-gland of prostate better, it is not sufficiently effective enough in the detection of atypical lesions alone. Currently, it still lacks the resolution to detect tumors with smaller volume and lower Gleason grade. Ultrasound is typically the first route of medical imaging technology used to diagnose prostate abnormalities associated with cancer. The reason being is that it is non-invasive, causes no health problems or issues, as it does not use ionizing radiation, meaning it is safe to use more than once. There are no known harmful effects associated with ultrasound, although some patients experience slight soreness in the back for a couple of days after the ultrasound. Some of the advantages of ultrasound for imaging prostate cancer is that it is useful in determining the size of the prostate and allows demonstration of the zonal anatomy. On the other hand, ultrasound is not a high imaging modality, therefore it cannot produce high contrast images, making it difficult to detect lesions and accurately stage cancer. With new emerging imaging techniques such as MRI imaging, limitations of less advanced imaging technologies like ultrasound can be overcome. MRI produces extraordinary precision and resolution of soft tissue contrast that is necessary to accurately characterize localized prostate cancer. It's its ability to detect clinically significant prostate cancer by providing information based on the location of the tumor size, stage, and grade at which makes MRI so valuable in the medical industry. Unfortunately, There are safety concerns associated with MRI scanners, and it's typically an issue with patients with internal implants, such as artificial joints, cochlear implants, stents, and pacemakers. The strong magnetic field of an MRI scanner can pull and potentially dislodge the implant, and strong radio frequencies can heat up the implant, in severe cases cause damage and burn surrounding tissue. Patients may also experience temporary hearing loss, and in severe cases, tinnitus due to large knocking noises made by pulsed gradient field of the MRI.